And you can make what is the advantage chroma?
See, they say that in chroma, some of the lesions will be more useful.
Fetal.
Whenever you are using fetal stem, this is very useful. But in this particular case, there is not much use because that nodule is already well seen. So yes. But,
come to normal. Yeah,
They
this
are
is.
suspecting anything.
With this one eye scan again.
Ultrasound larynx. What is the advantage chroma?
so
You can see
they
the
say that in
thyroid
chroma,
cartilage.
some of the lesions will
Yeah.
be more
Vocal cord. Fetal.
Whenever you are using fetal stem, this is very useful.
E anama. E
In
anama.
this particular case,
E anama. E anama.
because that nodule
గట్టిగా
is already
open
well
open.
seen. So yes. See, both are open. These are false.
Yeah,
They
this
are
is.
suspecting anything.
Come. This
So
two.
with this one eye scan again.
Say అమ్మ చెప్పు ఇప్పుడు చెప్పు. What is the advantage
See,
chroma?
they say that in chroma, some of the lesions will be more useful.
Right, fetal.
Whenever you are using fetal stems, but in this particular case, there is not much use because that nodule is already well seen. In this case, you will have to recurrent malaria.
Come to normal. Yeah,
They
this
are
is.
suspecting anything.
Mission to get the identification of these.
With this one eye scan again.
And you can make what is the advantage chroma?
See, they say that in chroma, some of the lesions will be more
Yes, fetal. This is the upper part. Go to the upper part. Then inferior part, inner part, inferior, superior border, inferior port. So you can see the saline please now. You put in the center and this center. Okay, this center is center, this center, right? And you join this motor. Blue is better. Now see dimpling here. Where is the strap muscle? Pritam, you show me. Yeah. You give incision. Skin 5 cc needed first. Technique wise I will do. Or you can use BD syringe now first. Use insulin syringe for a skin entry. 5 cc needed. 5 cc gel can use. Incision side, incision side. Okay. Inject. Inject it. Yeah, inject. Here, just give me, right. Now, see, yes, now I am at the false capsule above, false capsule, strap muscle below. Inject. See, okay? See this blade, okay? Now you can see this video right for 5 minutes because for observation. Then you come forward. Now the anterolateral hydrodissection. You see there anterolateral hydrodissection of the carotid sheath. There intracapsular, false capsule, true capsule. Saline, some saline here. With the saline posture. Inject. No. Temporary because this will numb the what nerves you will have there? Carotid sheath, vagus, sympathetic ganglion. So you will get temporary. So make your own road. Now yes, sir. How much? 3 mm minimum. You can see that there. You can how much? Freedom. See more than 3 mm the film is. So water barrier, water jacket is more than 3 mm. If you want, you can inject. Air systemic. If you want, you can go posterior laterally, but very difficult. Vessels, all this. Thyroid. Okay.
So, తప్పదని
Saline
తప్పనిసరిగా you have to use
Saline?
it.
Good,
Okay,
sir.
okay, okay.
Door button.
Inject, no. No, no, gland on the form, elevate అయిపోయింది. Inject, 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 slow, slow. So that type of again absorption, you will see fast absorption. That is the reason we don't prefer a saline. Okay? Now the incision, please. Blade. Always 14 gauge needle. Before inserting, you have to check whether it is antenna working or
ఇంకా
not.
స్టార్ట్ చేయలేదు సార్.
It's stuck, it won't work.
వస్తుంది.
Huh?
Sound వస్తుంది.
ఎంత ఇచ్చారు అద్దా వస్తుంది ఆఫ్టర్ 10 seconds will get.
వస్తుంది సార్, వస్తుంది.
Incision. First incision, make out this direction. Okay. Now you can see. You see now. Okay. Okay.
You're down.
Right. Huh?
Yes, sir.
Happy? I am reached the outer body. Right? Then we'll start the fire. Better.
ఇంకా మీకు చారు వస్తుంది.
No, ఒక యాంటీనా ఒకటి ఉంటుంది. Now you can see cooking, slow cooking. And no, he'll have tip is longer tip, big tip ఉంటుంది. Lateral, it's very lateral ఉంటే we don't go